as you know, the historical perspective on this even started on the time of Socrates and of the Hippocratic Oath. As a matter of fact, even Sigmund Freud talked about the dialectics of Socrates and formed the concept of transference and countertransference. When we talk about the social doctor-patient relationship, we also have to take into account the social determinants of health. And what exactly do I mean by this? They are the conditions in which people are born, grow, and work, and live and age with a wider set of forces and systems changing the conditions of daily life. And here in this graph, you see the different layers of the social determinants of health, starting with people, lifestyle, the economy, activities, the environment, even the global ecosystem. Additionally, when we talk about social determinants, let's not forget the important role of social media, which is continuing to evolve and influence the doctor-patient relationship. As a matter
the situational factors pertinent to India, education status and language barriers. Now, this is more so important because India has more than 24 state languages, right? Some of them are really different from each other, and double the number of regional dialects, right? That runs in villages. So when the patient comes, although they may be speaking to you in Hindi, which are a national language, it could be broken one, or it could be absolutely in something that you don't understand. Explaining about bad prognosis is something which is very important, and I think this is something that we are doing must be explained to the relative beforehand. Even when the patient is admitted, tell them beforehand that this is what can happen. We hope for the best. Maybe even make them sign that there is a bad prognosis that has been explained, and it has to be broken very careful, because we've had cases of violent mobs, coming, and it has even resulted in doctor death. Patient may sometimes travel from very long distances coming to take referrals and may be belonging to a lower socioeconomic strata. So here the economics are there, so may have come late, but you might have to take this into account that the patient has come just to see you. So even if the time is over, make
directed at employees or service staff, and it includes our, us, our doctors, and also our cooperative staff, like nurses and receptionists. So customer harassment not only causes significant emotional, psychological stress for employees, but also creates challenges for businesses in balancing customer satisfaction with the well-being of their staff. So there are some types of customer harassment patients in Japan. So entitled patients, they demand high quality results at low cost or within a short time. For example, they mind very light, very slight, tiny brownish spots, which actually sometimes I cannot recognize, but they insist, and they wanted to be treated, and they expect cosmetic level outcomes from treatments covered by the insurance.
It's very important when you manage difficult patients, you need to avoid trouble. How to do that? First, be polite and open with patient. We all know that good communication skills is essential for a healthy doctor-patient relationship. Develop good rapport with the patients. 2, keep accurate notes, which is extremely important. Size, locations should be well documented. Take photos pre and post laser procedures. Inform consent to procedures, know your limitations, and be competent in whatever you are doing. Standard of medical care. The standard is that of a reasonable duty, right? The quality of care at a level consistent with quality of knowledge and judgment that a physician is expected to possess. And the duty based upon the proper use of such medical facilities in your area of practice, the services, equipment that are available to the physician. This standard of care is set by expert testimony, medical literature, clinical trials, scope of aesthetic medical practice as in Malaysia, clinical practice guidelines, and very important thing you must remember that a 70-year-old doctor must meet the same standard alertness as a 30-year-old doctor. Medical negligence, things can go wrong in terms of diagnosis, treatment, information disclosure.
And then, hearing out the patient, that sort of a thing. Maybe when you're talking to the patient, you can make the patient feel the patient is not alone. It's not some rare kind of a disease which will not go away. As I mentioned, it could be, talk which is you keep a distance, but sometimes you could even, make a remark which is a little in the lighter vein, a witty remark, something like that. What happens is the patient opens out a little bit more to the doctor, thinks that the doctor is somebody who you can be a little comfortable with, and you establish, that. So it's a direct way, maybe looking and interacting with the patient. That is one thing that, I can do. If I want to also examine the patient, take the patient to a place where patient is comfortable and, maybe having somebody with me. And, sometimes patients are, exposing also, you have to give them that space and time to get familiar with. So these are things, which you can think of making the patient feel a little bit.
Yeah, thank you, Krissy. Thank you also for the other panelists for sharing their experiences in developing trust. I perhaps would like to maybe focus on the patient experience, because I think from the time they get contact with your secretary, with your assistants, before they see you, they have already gotten a lot of these experiences. And I think we have to be very mindful that they have a pleasant experience, not just with you, but also with the staff around you, because they all are reflections of you. In my particular practice, I focus on psychodermatology patients. So I have a unique perspective, meaning to say the patients that come to me have already been diagnosed, have actually been referred by other dermatologists. So I don't do that part. Typically, my sessions for psychodermatology are 1 hour. I feel